Recently, nurses in Frome have been striking for better pay as part of the National NHS Workers campaign. Julia Wellard went to talk to some of them outside the Frome Health Park.
So I'm with Amy Mitchell now. Amy, where are you usually based?
So I work at Shepton Mallet Ambulatory Care Unit. It's situated up on the old community hospital ward. We are basically an outpatient unit that do a lot of procedures for central lines for patients that are having cancer. We take bloods, we do iron infusions, blood transfusions, we do IV antibiotics, things that if the patients was having them done, they would have had to go to an acute hospital. So we look after them rather than them staying in an acute hospital.
So that sounds quite specialised work.
It is. We have to have a lot of clinical skills and retain, when we have to recruit staff into that job, they have to have good clinical skills as well. But you're also lone working, so you have to be able to have the knowledge behind you that if you get a problem with the patient, you know what to do. And that's why I'm here to strike, because I've got a lot of clinical skills, and obviously we're not getting the pay that we deserve for those clinical skills that we've got. To be able to do it, I have to have childcare. I've got a 10-month-old daughter who goes to a childminder. That's £400 a month. And then obviously my bills. I don't see any of my wages. We live on my husband's wages. When I went on maternity leave, I tried to recruit staff into my role to cover myself. They accepted the job. Then they decided that because of the situations, like the pay, the skills that they needed and everything like that, it wasn't worth it in the end, so they decided not. The trouble I have is at the current time it's only myself and another staff nurse that work in the unit, which means when I want to go on annual leave, there's nobody to have those skills that are needed for that unit, so I'm working in there.
So you don't get any holiday?
No. No, but it means that I'll be doing some bank shifts to cover my own annual leave. So.
Right. Alison, you're actually at Frome Hospital.
I am, yeah.
And you've been on strike here. And what are you hoping for? What are you hoping will change here?
We want to try and encourage more people to come into the profession. We want safer staffing for our patients. As you can see from our banner, we've got over 47,000 vacancies still to be filled. We've been trying to fill these positions for the last 10 years or even more, and try and encourage people into the profession, but above all we want safer staffing for our patients so we can deliver the care that they deserve.
So what are your responsibilities on a day-to-day basis at the hospital?
Okay, my responsibilities are to ensure the safety of the patients, make sure that they're getting the care that they need and it's been delivered appropriately and safely, and make sure that we have safe discharges for them, and that's just the basics of what we do at the hospital, at the inpatients.
And you were telling me that the ratio of nurses to patients is not so good anymore, that it was, what was it before?
Okay, well at the moment we've got about 26 to 28 patients. During the day we have 3 nurses that cover all of those patients. At night it can be a bit difficult trying to get people to work nights. One shift we actually had 2 nurses on looking after 14 patients each, and that's not really acceptable.
Some people think it's fine at night because everyone's asleep, but I know from being in hospital myself that's not the case.
No, it's not a case. Patients that are coming in onto the ward now are coming in with more complex conditions, complex needs. We're having people that might need an antibiotic earlier in the morning. You need trained staff to be able to deliver that antibiotic. So yes, patients' needs are becoming more complex now that are coming in onto the ward, and they're needing more complex care needs as well. So yeah.
How long have you been at the hospital here?
I've been here 3 years. I have been nursing coming up to 9 years. I've done both the acute and community hospital.
Right. Well, I hope things improve for you.
I do. You know, it's making sure that we've got safer staffing, also getting the right equipment in so that we can do our jobs properly and effectively and safely.
Have you had a problem with equipment?
Sometimes you're looking on the ward looking for an observation machine. It might not be working. Looking for diabetic glucose glucometers, again, they've been a bit short. And also, you know, things that we're getting for personal care needs are becoming pretty substandard now. So we want to try and deliver a good quality service for our patients.
Thank you. But you've had an interesting route. So you started at university doing a nursing degree, is that correct?
Yes. Yeah.
And then when you left university, what happened next?
So I started working on a acute gastroenterology ward as a staff nurse. Consolidated my learning from university and learned all about that kind of medicinal route. And after that, I changed to work in respiratory. Gained some experience in respiratory medicine, and worked my way through to A&E, where I worked as a Band 5 nurse in A&E.
So where was that?
That was at Bath Royal United Hospital. Worked there for a number of years, and again worked my way up to being a sister. Worked there as a Band 6 sister, being in charge of different areas of the department. And learning different skills such as triage, so making sure people that come through the front door are safe. And then I progressed again on to being a nurse practitioner.
So explain what a nurse practitioner is and what they do.
So I'm an emergency nurse practitioner. There are a few different types. So you've got medical nurse practitioners as well as surgical and stroke practitioners. There are a few different routes. So it's going back to university, doing more training, and specialising in an area. So as a practitioner you can usually see, treat and sometimes discharge patients. You're an autonomous practitioner, so you're making decisions around their care, and then usually it kind of leads on to prescribing as well, so you'll be able to prescribe medications to facilitate their care.
It sounds pretty close to being a doctor then.
Yes. We work with doctors. So in the minor injury unit, it's nurse-led. But if we need to refer or discuss patients with doctors, then we would speak to them directly for advice, or whether or not people need to be referred on for further care and treatment. We sometimes refer people back to their GP if they need follow-up care. But generally, we do try and see and treat and discharge patients. And get them better.
So what problems have you noticed? I mean, obviously you know about the problems nationally, but here, what sort of problems do you find?
So recruitment of nurses is, I think, anywhere, not just in the minor injury units. I think on all the wards and actually throughout the country, there just isn't the nurses. There's just not the staff there to recruit into any of the jobs. We can't encourage the young people to come into the profession. I think there has definitely been a drop in university applicants, and even those people that do start university, many of them do drop out. They're having to pay out student fees. They're coming out of university with about £9,000 worth of debt. I mean that's approximately, but they're coming out with that. Plus, it's a hard course. It's not like a normal university course. They're having to work on placement as well as do all their degree, like dissertations and things like that on top, without being paid, and usually having to work a second job just to live. So it is a hard course, and to come out the other end and to be paid a very low wage in comparison to, if you worked in a fast food shop or if you worked in a supermarket, you'd get a very similar wage. But for all that effort to come out and responsibility, why would nurses want to do that? So why would people want to do that? They would, it's not just a calling. There has to be that calling there, but it also has to be viable. You need to be able to eat and pay the bills. And if we can't pay nurses fairly, we're not going to encourage people to come in the profession.
What sort of public support have you had?
Public support has been amazing. The public have come up to us and they've given us, they're trying to give us gifts and things to show their support, but actually just to say that they're on our side is all we need. And they've been doing that in the hundreds, I would say, over the past couple of days. We've had people come in and honking their horns at us to show support, coming out and raising their thumb to show support when they're walking or riding their bikes across. Had lots of local people come and play live music and give free ice creams. And
Ice cream sounds wrong.
Yes.
I thought you had to have hot soup.
We did have hot soup yesterday, followed by ice cream. So a lovely gentleman come on his bike with he was pulling a little ice cream cart, and he gave ice creams too. So yes, we had hot soup delivered by a local lady. Yes, it's just been amazing. People have been really supportive.
So do you think the government is going to negotiate anytime soon?
I'd like them to. They need to just talk. It's not about saying yes, you can have it. It's about they need to come to the table and be reasonable and discuss the issues and discuss the options that are available. Wales has started talking, Scotland started talking. We just need the government to talk.
So I understand that nationally you're actually asking for a 5% rise above inflation, but I've again read that you are also willing to negotiate even on that.
Absolutely. I think if they decide that they are going to come and talk, there'll be lots of options available. There'll be plenty to talk about. There is more than one way to fix things. Yes. But if they don't engage, then we're never going to get anywhere. But everybody uses the health service. It's a national treasure. We need to save it, and it is definitely on its knees. It's just going downhill everywhere, not just staffing. Morale has been broken because there's only so long you can go on work on goodwill, and lots of nurses do that. Lots of nurses stay long behind to finish their documentation. They stay behind because they feel that they need to give that patient care, and
they're going over and above.
They do go over and above. Absolutely, they go over. Yes, so nurses, their goodwill is starting to dwindle, and lots of people are retiring because they can't cope anymore, because there's no staff. They're working on less numbers, and which is putting a strain on them, which is leading to burnout, and then people are just getting washed out. So nurses are 20% worse off financially with all inflation, and they're having to work second jobs, or they're having to work on the bank or agency just to make ends meet. They're having to use food banks. It's just not acceptable. All they're asking for is a fair wage so that they can live, so that they're not then burning out, so that then they're not, they can give good patient care. And if we can then encourage people into the profession, we will build our workforce again. And we are the backbone of the NHS. Nursing, every point of NHS thing that you access, there is a nurse there behind the scenes.
Thank you very much. I just want to end with one question.